Well, hello, everybody out there listening. This is our Start or Sit podcast. This is actually our third year of doing this. I'd like to introduce and welcome again for you folks that may listen last year, but we are joined again this year by Dr. Chris Hawkins. Dr. Hawkins, how you doing?
I'm doing wonderful. Had a good summer and looking forward to the fall and getting excited for football.
What's your favorite part of the fall besides Halloween? Come on.
Oh, it's honestly, it's being able to get outside and, have a little fire going and enjoy the weather before it turns completely wet.
I love the fall. I love this time of year. So, again, for our listeners out there, we're going to talk about previous week's injuries in the NFL. This is geared towards you fantasy football players. And we're going to talk about the injury, return to play. Are they going to be starting that week? Are they going to have to sit? How many weeks are they sit? Should you trade? Should you draft? What do you need to do from a decision process on your fantasy football team? Just to kind of review, Dr. Hawkins is an orthopedic surgeon, sports medicine specialist. Give us a little shout out, Dr. Hawkins, about kind of your practice for maybe some of our newer listeners.
Yeah, no problem at all. I'm a sports medicine fellowship trained surgeon. I've been in practice now going on almost 25 years. I spent my first 20 years back in the Philadelphia area, and I've been out here in the Pacific Northwest going on 4 years now. And basically, I do a lot of arthroscopic surgery. I'll take care of predominantly shoulder and knee injuries, but in doing all the athletic coverage over the years with football games and professional and collegiate players, we kind of cross over into a lot of boundaries, a lot of other injuries, the little nicks and sprains and strains that happen kind of all over the body with some of these athletes.
Well, personal shout out for me. I'm looking back and reviewing some of the information, some of the players we talked about last year, and you're spot on. Your expertise and your prediction and your ability to kind of assess and determine what that injury is going to look like, how long it's going to take to heal. I mean, you do a great job on this. And again, I'm excited to have you, and I'm excited to be doing this our third year. My name is Shannon O'Kelley. I'm the president and CEO of IRG Physical and Hand Therapy. I've been a physical therapist and doing this for about 35 years. So I'm from the school of hard knocks, so to speak. I've had a lot of experience. So I get the luxury, and our team gets the luxury of when these athletes are injured and they need to rehab, we get to get them on that rehabilitation process. Very exciting. It's always nice to take someone that's been injured and return them to functional, pain-free activities. Doesn't matter if it's an athlete, a recreational athlete, or an injured worker. We're just happy to do that. So let's get started here with our first player, and this is a big one, people. I had the opportunity to watch Hard Knocks this year on HBO. I always love that program. It's a training camp series, and they followed the New York Jets. And everybody out there knows that Aaron Rodgers left the Packers after – that's the only team he ever played for is the Packers when he came out of Cal. I don't know how many years ago. Aaron Rodgers, 39 years old, went to the Jets, played 4 plays on Monday Night Football just this last Monday night against the Buffalo Bills. Huge game. And guess what? He tore his Achilles tendon. Dr. Hawkins, let's talk about that. That's a tough injury. Tell us about that.
Yeah, so as a lot of our listeners have probably heard already, that's a hugely devastating injury for them. It's going to change the trajectory of their season. When you look at the Achilles tendon, that's one of the sort of the largest central, tendons you have in the body lengthwise, and it comes from those calf muscles, your gastrocnemius muscles, and comes down and attaches to your heel bone, your calcaneus. And so it's critically important for everything you do with regards to walking or pushing off. And when you watch that injury and they slowed it down, it kind of gave everybody the memory of Kevin Durant having that injury where you could see him.
Yes.
He was going down. His ankle was getting pushed up. His body weight was going the other direction, trying to force it. And all of a sudden, you just saw that calf muscle just quiver and shake. And that was the Achilles tearing and sort of letting go. So obviously a huge injury.
Yeah, when I saw that on replay, I mean, again, the 4th play of the series, big expectations, sold out stadium. I think the Jets have sold out their entire game schedule at home. Maybe the first time they've ever done that. And again, I watched that replay, and that's the first thing I thought mechanically looking at that, what you just described, that's a torn Achilles tendon. I mean, that repair process from a surgical standpoint, you got to go in and fix that, right?
Yeah, there's some data out there that if you're not an athlete, it really came out of Canada where you can potentially treat these things conservative,ly put them in a cast and essentially keep their foot bent down, bring the ends of the tendon close together and let it try to heal. But the re-rupture rates are significantly higher. And obviously in an athlete, you're not going to accept that. So it's a surgical treatment. Generally they'll try to get to that relatively quickly. Most of the time it's a suture repair. So you're bringing the ends of the tendon together with suture attached. And the big issue is there's two sides to healing. And you know this with all of your vast experience in the physical therapy world. It's healing of the tissue, but then it's dealing with all of the atrophy and the weakness that develops.
Yes.
And the Achilles is a unique one. You can't go too fast. You can cut a few corners sometimes to avoid being stiff, but if you go too fast, you jeopardize that healing and the actual length of that tendon. If the tendon length is longer than it was as it heals, then you're not going to have the power. You're not going to have the ability to get back to the same athletic level in the long run. So you can't, sometimes you think, hey, these guys are superhuman. They'll rehab quicker. This, unfortunately, is one of those injuries that, you need a good surgeon, you need a great physical therapist, and you need a motivated patient. And even with all those things, it's a 9-month process.
Yeah, technically, theoretically, just based on what we know with the rupture of the Achilles tendon needing surgical repair, you just talked about a 9-month process. Aaron Rodgers is out for the 2023-2024 season.
He's got no chance of playing, and obviously the speculation comes in if you're in fantasy and you did want to try to have what's called a keeper league and you're keeping him for next year. He's a motivated guy, but you really got to wonder if he's gonna. They were wondering if he was going to be able to perform as well this year before the injury. Coming off of that, I'd be really worried about him next year.
Yeah, Jensen, our producer here, sitting right next to me, had Aaron Rodgers on his fantasy football team. Any recommendations who he should pick up? Because now I'm not laughing, but I'm laughing because Jensen's right here and he looks pretty distraught. He lost Aaron Rodgers. Aaron Rodgers, to me, he's the GOAT, and the whole season for the Jets changes. Now Zach Wilson looked pretty good, but with a complete rupture, you're out and returning to play at 39 years old next year. He'll probably be able to do it, but like I said, keep an eye on him. There is one guy out there that kind of surprised everybody in the NFL, and that was, remember Terrell Suggs? I think he ruptured his Achilles tendon and came back 6 months after the surgery. Is that right? Do I remember that right?
Yep, you do, and he is the outlier. Yes. Obviously, when you look at nobody expected him because he was a big guy. He was a speed rusher and a strength rusher, so he had to push off really hard. And a lot of people thought he wouldn't come back. I think they got him a little bit of an orthotic, like a prosthetic that gave him a little bit of a leaf spring type of support to help him. Yeah. But you're right. He beat the odds and came back and had a pretty productive career afterwards for a while.
Yeah, and you're exactly right when you said earlier on, it's the immobilization. You have to put these patients, these folks, post-surgery in a boot. You have to protect that Achilles tendon so it scars down or heals. But when they come out of that boot, because of the boot, they have a lot of atrophy, they have a lot of stiffness. So it's a rhythmic or a rhythmatic approach to the rehab. You can't go too fast and you can't go too slow. But there's some good results out there in the right hands. So people do return, athletes do return. So Aaron Rodgers is out for this year for sure. Let's talk about our next one is Mark Andrews. These are some soft tissue injuries. These are early season type stuff. A lot of times you see these in training camps when these athletes are getting out and they have these soft tissue strains. And Mark Andrews, tight end, Baltimore Ravens. Pretty good producer, great tight end. Quad injury. What do we know about that?
Well, as the name suggests, it's actually 4 muscles that kind of come together in the front of the thigh. And most of the time when you look at these quad strains, it involves the most superficial part, what's called the rectus femoris, because that's the one that crosses 2 joints. It attaches to your patella, so it goes down and crosses the knee joint, but it also comes up above the hip joint and crosses and attaches to the rim of your pelvic bone. So typically with these quad strains, that's the one that takes the brunt of the injury and tends to set people back. He's a big frame tight end, and I think they were basically expecting to try to ease him back. He practiced all last week, but never had a full unlimited practice, and has started off this week also practicing, but in a limited capacity. So his decision about being able to come back is probably looking at the next 2 days. Does he make it into a full unrestricted practice? If that happens, then they probably think he can progress. But just like you said, these early season injuries, Shannon, and a big frame guy, they want to err on the side of caution because they know it's a long season.
Yeah, are you saying he's 50-50? So if I have him on my fantasy football team, am I 50-50 at this point in time? Play, sit? What do you think?
Yeah, I think right now he's a sit.
Okay.
But I think if you get to Friday and you see a full unrestricted practice that he participated in, I would flip that and say he's a play.
Yeah, okay, good. There's a 50-50 on Mark Andrews. Great tight end. Just to point it out, it's public knowledge. I think this gentleman, Mark Andrews, great player, but, he also has I think he's a diabetic, and I think he's talks about how at times during games he is treating himself on the sidelines. Is Mark Andrews? Am I correct on this? Is he a diabetic also?
Yeah, you're correct. And there's some speculation there about, obviously, does that cause some issues with regards to soft tissue healing? I believe he's in a situation where he has an implanted pump and he does a pretty good job.
Right.
So I'm sure he does, keeps it about as under as good of control as anybody can. So I don't think that'll be a huge variable in his case.
Yeah, I know as a physical therapist, I'm sure as an orthopedic surgeon, you're aware of some of these issues or some of these underlying maybe diagnoses that some patients have, and diabetes, if it's not controlled, is a problem. Can be problematic for healing. And for any of you listeners out there, take care of your diabetes if you have it. It is needs to be looked at. Okay. Our next one, you just talked about healing and maybe returning to play, and you got to be very cautious. And again, the process and the progress with soft tissue injuries. You can get an early strain of a muscle early in the season. And if you start back too soon when that muscle's not completely healed, I should say, and you re-irritate it, these things can linger. And this gentleman right here, super important to the LA Rams, Cooper Kupp, wide receiver. I understand he tore his hamstring early in preseason, kind of rehabbed it, and then came back and re-aggravated. And he's been sitting. At least he sat the first week, and I think he plans on sitting for maybe 2 or 3 more weeks. What do you know there?
Yeah, they decided as a team to take the decision away from him. So they put him on injured reserve. So he's definitely out the first 4 weeks. And I think that kind of plays into, we've talked about Cooper Kupp in past seasons.
Oh God, yeah.
He's got a bit of a folk hero following, obviously, out here in the Pacific Northwest. Yeah. And, he's the kind of guy that he's a tough guy. And I think he would try to push himself, be less likely to, say, I can't do this. So I think that was a decision made at the staff and the medical level to just say, hey, you're out for 4 weeks. Don't worry about playing. Just go to your rehab. Take your time with it. And it's interesting. I think more teams are starting to lean in that direction now because, again, they're looking at a long season and they just want to get these guys good in the beginning and not have them go back and forth like a yo-yo. Because I think another name we've talked about, Shannon, is Darren Waller, that tight end.
Yes, right.
They're already sitting him for hamstring soreness after the first week. So he was a guy that last year, every week, I think he was questionable, and it's because they didn't just take him out and let him get better.
Yeah. That's just it. These soft tissue injuries, it's amazing. They need to heal up. I'm sure, from an orthopedic standpoint and also from a physical therapy standpoint, anytime we see these strains, these muscle strains, we like to grade these things. We like to grade them usually 1 through 3 or 1 through 4, depending on kind of your school of thought that you come from. But I would imagine Cooper Kupp, based on their giving him 4 weeks, probably had a significant strain of his hamstring sometime in preseason that's just they want it to heal. So he's out on injury reserve for 4 weeks. All right? Good so far?
Yep.
Everybody's good. Hey, big name here. My gosh, do they need this guy back? Let's talk about the Kansas City Chiefs. Got beat by the Detroit Lions. Man, the Detroit Lions look pretty good and well coached. I like their coach, but Detroit beat Kansas City, and I think it's pretty apparent Travis Kelce is a huge part of their offense. I think Patrick Mahomes really missed him. This Travis Kelce guy seems to be, if he's on your fantasy football, every time I watch him, he seems to be that guy. Like Cooper Kupp just gets open out of nowhere. He's got a hyperextended knee, and I think they tried a bunch of stuff to look at him, had him walk in some water. They were really trying to get him on the field, but he wasn't able to do that. That hyperextended knee, there's a lot could be going on there.
Yeah, I think the most concerning thing from the reports that came out is that they actually had to, aspirate or drain his knee because of the swelling. And again, according to the reports, it was not just what we call clear fluid, like joint fluid. There was blood in it as well. So obviously, they did all the imaging scans on him, and they didn't see anything like ligament damage or clear fracture in the bone. But whenever I hear about what's called a hemarthrosis, that bloody fluid collection in your knee, there's been some degree of injury. And you really have to wonder, is that something that you're going to aggravate or injure more significantly if you push it too quickly? And I think he's cut from the same mold as Cooper Kupp, where he is going to push himself. I followed obviously his brother a lot, being in the Philadelphia area, and the Kelce brothers are pretty they are pretty tough guys, and they play hard and they live life hard, and I think that may be something that I think he will play. I think he's going to tell them he is fine, and he's going to push himself through it, and he'll be a play this week. But if he's on your team, I'd start looking for somebody who's doing well as a tight end, who's under the radar. This past week, I think Hunter Henry and Hayden Hurst were both low projections, but they both got a lot of points. I'd stash one of those guys on your team if you have Kelce, because I think he may set himself back, because he may try to play so hard his knee falls off.
Yeah, that's a good point. And this is one of these injuries that, again, it's biology. I mean, it just that soft tissue, that bone bruise, whatever, it just takes time to heal. You can enhance the rehab and maybe promote maybe some of the anti-inflammatory processes and increase and expedite the healing, but it really is biology. So when you talk about when they aspirated that knee, I just want to kind of dive into this kind of bloody fluid that they pulled off there. So they're assuming that there's a bone bruise and probably hyperextended the knee, the tibia and the fibia kind of jammed together at the end. Something got bruised. Caused some kind of bleeding in that, what we call that synovial fluid. But people need to understand that end of that bone is covered with periosteum, and that is very sensitive and highly vascularized. Tissue, isn't it? I mean, it's very nerve focused.
Exactly. And that's exactly the point, is where did that blood come from? And, my biggest concern is with a bone bruise, did you have some type of small, what we call subchondral injury in the bone? So just beneath the surface, almost like microscopic, cracks or fractures. And did that cause the bleeding to occur? Something that they don't see, what we call like a fracture line, like a true break, but it's been weakened. And so you have that situation where, okay, you're going to start loading it again. And therefore, if that injury, it's like dropping an apple off a counter. When it hits the ground, at first it's like, I'll just eat that, but it sits for a day, and then you've got a soft spot there.
Right. Yeah, that's important to recognize. And for our listeners, I mean, there are situations in when this happens that you can actually disturb the underlying tissue. That if I can describe it, I mean, and correct me if I'm wrong here, but that tissue underneath that hyaline cartilage that covers your joint surface, that's that resilient, glistening cartilage that we all want. But if that gets damaged underneath that, it doesn't have very good blood flow, you can get kind of what we call an osteochondral maybe defect there. And I think that's a concern too in that area, particularly the knee articulation. Is that fair to say there?
Yeah, and that's a really common problem with a lot of high-level athletes. If we switch sports to the NBA, that's actually what ended Greg Oden's career, the old Ohio State center that came out to Portland.
That's right.
Yeah. So he, and he was just a big guy who, was jumping and landing a lot, but he had a couple hyperextension injuries, and then he ended up with essentially those osteochondral lesions led to premature arthritic issues in his joints.
Right. And that's what, just kind of tidbit here, as a surgeon, sometimes in the, maybe, I don't know, the yesterdays, but they used to do these microfracture surgeries. And what you guys as surgeons would do is you'd find those osteochondral deficits, and then you would drill holes in there to enhance the blood flow into that deficit area, because blood brings healing properties, and you're trying to get that chondral defect to heal. And are you still doing the microfracture surgeries, or is there a better technique and regenerative or, biologics that you guys are using now?
You can still do it in certain situations, and there's a lot of little minutiae as far as location and size. The benefit of microfracture is being probably the least invasive. But the bigger thing nowadays is trying to get like autologous chondrocytes, so get actual cartilage cells to grow into a defect. And so the newest thing is something called MACI. It's matrix impregnated autologous chondrocytes. Wow. So it's basically like they grow cells and then they put them into almost like a sponge that can then be implanted in that area.
That's fascinating. The biology and some of the regenerative things that are happening in medicine is pretty fascinating. I think in the next 5 or 10 years, we'll see some advancements there, that an injury like this, they'll be able to identify, do something from a regenerative standpoint, and that player will probably return pretty quick. Last one that we're going to talk about for today. This has been awesome for the first show of the 2023 and 2024 season, NFL season. This is our Starter Sit podcast. We're talking about players that have been injured. Are they going to be able to play this coming week, or are they going to have to sit? I'm joined here with Dr. Hawkins, orthopedic surgeon, sports medicine specialist, doing a great job. Kenneth Gainwell, running back, Philadelphia Eagles, the old dreaded rib injury. Man, talk about painful. You ever hurt your ribs, Dr. Hawkins?
Yeah, I've been blessed. I haven't had that injury, but I've had enough players miserable from it that I feel like I know what it feels like.
Oh my God, just a minor injury of your rib. Your rib cage, people that are listening, your rib cage has to rise and fall. So every breath you take, your rib cage is coming up and down, and that's how you kind of exchange air in your lungs. Now, duplicate that in speed and timing, and you're running and huffing and puffing, those ribs are coming down. So they're very painful injury to have as an athlete. So what are we going to do here?
He's going to be a sit for sure. They have a pretty deep running back committee, and so I think he's just going to be a sit this week. They'll take him out. Play. They'll elevate probably Boston Scott. I think is their third running back. He'll move up to the second spot, and they picked up DeAndre Swift from Detroit, who is a good back. So I think that again they'll err on the side of caution with him early in the season. Make sure he gets a week off without a 300-pound lineman landing on him after a tackle.
Yeah, I'm laughing because, again, this is one of these biology things. This takes time to heal. They do have jackets and they do have rib protectors. But, can you imagine? this is a car wreck every time this guy runs the ball. That's essentially what's happening out on that NFL field. The contact, the speed and explosion. 2 weeks is, I hope he's better in 2 weeks, but keep an eye on that. So he's going to sit for 2 weeks. That's Kenneth Gainwell. He is, again, as a sit for 2 weeks if you have him on your team. Dr. Hawkins, hey, great job. Gosh, you do such a fantastic job. Your insights here and your ability to describe the injury for our listeners and explain what's happening is phenomenal. I look forward to this season, and I look forward to doing this next week. And until then, have a great week.
Hey, I appreciate it, Shannon, and you do such an outstanding job with all the physical therapy. I tell people all the time, again, it's 3 parts to getting better. It's, if they need surgery, we'll fix them, but they need to be motivated and they have to have a great physical therapist. So we appreciate everything you guys do. Absolutely.
You know what? And here's the world of medicine today is collaboration is so important, and creating collaboration and opportunities, because ultimately you and I both as providers, we got into this business. We want what's best for our patients, and there's nothing that's more joyous than watch someone come in that has been injured, and you get to fix them or then get to rehab them, and they're back doing what they love to do. And that's what it's all about. Okay? Thanks for your time.